Now I will introduce the Peabody Development Motor Skills second edition test. The assessment tool has a standardized format and the administration varies depending on the age of the client. This assessment is appropriate for anyone between their birth to 5 years old. The PDMS tool results can be used to estimate a child's motor competence relative to his or her peers. The gross motor quotient and the fine motor quotient can be compared to determine if the child is comparable in his or her motor abilities. The PDMS tool has value for education and therapy intervention because the qualitative and the quantitative aspects of individual skills and are assessed. It can also be used to evaluate a child progress. The quantitative information gathered on a child's performance during successive administrations of the test allow the examiner to make comparison across these administrations. Lastly, it has value as a research tool because the scores can be used to study the nature of motor development and the various population of children, the rule of motor ability and academic success and the effectiveness of various motor interventions. The PDMS tool includes both gross and fine motor scales. The gross motor portion includes reflexes, stationary locomotion, object manipulation, grasping, and visual motor integration. The fine motor skills include grasping and visual motor manipulation. The scoring for the PDMS tool is based on the scale of 0 to 2. A scale 2 indicates that the child has mastered the task. A 1 means that they show clear resemblance to master, but they don't meet the full criteria. And the score of 0 means that the skill has not emerged or the child refused to attempt a task.